The following are the four main roles in GPP guidelines, where pharmacist involvement or supervision is expected by society and the individuals they serve. They are first, prepare, obtain, store, secure, distribute, administer, dispense, and dispose of medical product. The second is provide effective medication therapy management. The third is maintain and improve professional performance. The fourth is contribute to improve effectiveness of the healthcare system and public health. These roles may vary for each individual pharmacist depending on their practice responsibility. Let's go to see more details. The role 1 covers many pharmacy practice areas, include prepare, obtain, store, secure, distribute, administer, dispense, and dispose of medical product. So there are 5 related functions in role 1. Function A describes prepare extemporaneous medicine preparations and medical products. Pharmacists should ensure that medicine preparation areas are appropriately designed for extemporaneous preparations and are maintained in a manner that minimizes the potential for medication errors and assures the cleanliness and the safety of medical products. Pharmacists should ensure that compounded medicines are consistently prepared to comply with written formulas and quality standards for raw materials, equipment, and the preparation process, including sterility and where are appropriate. Function B describes obtain, store, and secure medicine preparation and medical product. Pharmacists who are responsible for procurement should ensure that the procurement process is transparent, professional, and ethical so as to promote equity and access to ensure accountability to relevant governing and legal entities, and should ensure that procurement is supported by a strong quality assurance principle to assure that substandard, adulterated, unlicensed, and counterfeit medicines are not procured. To ensure that procurement is supported by a reliable information system which provide accurate, timely, and accessible information. Pharmacists should establish contingency plans for shortage of medicines and for purchase in emergencies. To assure that proper storage conditions are provided for all medicines used in the pharmacy or a healthcare facility. Function C describes distribute medicine preparations and the medical product. Pharmacists should ensure that all medical products, including medicine samples, are handled and distributed in a manner that assures reliability and the safety of the medicine supply. Pharmacists should establish an effective distribution system, which includes a written procedure to recall promptly and effectively medical products, with a designated person responsible for recalls. Pharmacists should develop with manufacturers, wholesalers, and government agencies an access plan for uninterrupted supply of essential medicines as a part of a disaster or pandemic preparedness strategy. Pharmacists have a responsibility to be aware of the safety issues of medicines and to institute necessary mechanisms for monitoring occurrence of adverse events. Function D describes administration of medicines, vaccines, and other injectable medicines. Pharmacists should have a role in the preparation and administration of medicines, in establishing procedures in their work setting with respect to the administration and in monitoring the outcome of medication administration. Pharmacists should have an educator, facilitator, and immunizer role, this contributing to the prevention of disease through participation in vaccination programs, by ensuring vaccination coverage, and by also ensuring vaccine safety. Pharmacists should participate in direct observed therapy DOT program in areas such as management of drug addiction, HIV, AIDS, tuberculosis, and sexually transmitted disease, where applicable. Function E describes dispensing of medical product. Pharmacists should ensure that appropriate facilities, trained personnel, standard dispensing practice, and document procedures are in place in the pharmacy for the supply and the dispensing of prescribed medicine and other healthcare products. Pharmacists should access and evaluate all paper or electronic prescriptions received, considering the therapeutic, social, economic, and legal aspect of the prescribed indications before supplying medical product to the patient. Where possible, generic substitution is recommended. Pharmacists should ensure patient confidentiality at the point of dispensing medical product and should provide advice to ensure that the patient receive and understand sufficient written and oral information to derive maximum benefit for the treatment. Function A describes the disposal of medicine preparations and the medical product. Pharmacists should ensure that regular monitoring of the medicine inventory is conducted in the process of periodic inspect for the expiration date and the removal of outdated stock. Pharmacists should ensure that recalled medical products are immediately stored separately for subsequent disposal and prevented from being available for fuller dispense or distribution. Pharmacists should establish a safe way of medicines with disposal at the hospital and or community pharmacy so that patients and the public can be encouraged to return their expired or unwanted medicine and medical devices. Alternatively, pharmacists should provide appropriate information to patients on how to safely dispose of expired or unwanted medicines. Let's move to role 2, provide effective medication therapy management. There are 4 functions in role 2. Function A describes access patient health status and need. That pharmacists should ensure not only medication therapy, but also health management, disease prevention, and healthy lifestyle behavior are incorporated into the patient assessment and the care process. Pharmacists should acknowledge unique patient considerations, such as education level, cultural belief, literacy, native language, and the physical and mental capacity in all individual patient assessment. Function B is managing patient medication therapy. Pharmacists should maintain access to an appropriate evidence base relating to the safe, rational, cost-effective use of medicines, such as reference books on medicine, journal, National Essential Medicine List, and the standard treatment guidelines. Pharmacists should ensure that medicine formulary are linked to the standard treatment guidelines, protocols, and the treatment pathway based on the best available evidence. Pharmacists should have a key role in educating prescribers on the access to and evidence for optimal and appropriate use of medicines, including the required monitoring parameters and the prescribing adjustment. Where appropriate, pharmacists should provide the advice or recommendation to the prescriber or medicine therapy, including the selection of the appropriate medication or dosage. Pharmacists should have access to contribute to use all necessary clinical and patient data to coordinate effective medication therapy management, especially when multi-healthcare practitioners are involved in the patient's medical therapy, and intervene if necessary. Pharmacists should be established a standard operating procedure for referral to physician, specialists, or other healthcare provider where appropriate. Pharmacists should provide continuing of care by transferring information on patient medicine as patient move forward sector of care. Function C describes monitor patient progress and outcome. Pharmacists should consider patient diagnosis and patient-specific need when assessing patient response to medicine, thereby and intervene if necessary. Pharmacists should document necessary clinical and patient data to access and monitor medication therapy and check patient therapeutic outcome. When needed, pharmacists should perform point-of-care testing for patients in order to monitor and adjust therapy. For example, INR, blood sugar, and blood pressure. Function D provide information about medicine and health-related issues. Pharmacists should ensure that in every pharmacy there is a suitable place for discussing confidential information with the customer and the patients. Pharmacists should provide efficient health, disease, and medicine-specific information to patients for their participation in their decision-making process regarding a comprehensive care management plan. This information should aim at supporting adherence to treatment and the empowerment of the patient. Pharmacists should be proactive in reducing antimicrobial resistance by providing information about this appropriateness use of antibiotics to consumers and the prescriber.